first off, I know you have a few words you want to say, but just talk about what we're out here for today.
Absolutely. Yes, good morning. We're here and excited to announce that University of Michigan Health-Sparrow will be transforming this former Rite Aid behind me into a new facility that will house pharmacy services, state-of-the-art pharmacy, in addition to our urgent care and occupational health services. As you know, in the state of Michigan, many of the Rite Aids have left the state of Michigan, and our teams are willing to step in and fill this gap for us, and we're excited to announce this to the community. Many families and patients have had a hard time receiving those necessary medications over the past few months. This Rite Aid here serviced almost 94,000 prescriptions, and we know that there's a huge need within the community, and we're here to help make that happen.
And talk about the expansions and what that will offer.
Yes, and I have a couple experts here, Stacy and Patrick, that are going to talk about two other services that we're going to put in the building, in addition to our state-of-the-art pharmacy. And they do exist here on Michigan Avenue already, but we're going to bring all of the services together and really allow patients to be able to access them easily, easy in, easy out, and also at the same time. So again, one-stop shop for those services. So I can turn it over to Stacy to talk about the pharmacy.
Yes, great.
Thank you very much.
Okay.
Going off where we just were with Constance, talk about the need that you guys are seeing in the community right now. Why is it important to have this, especially so close to other resources, and then go into depth about what you're an expert on?
All right. So being the director of Pharmacy Plus, we have a couple locations near us already, but with Rite Aid leaving the community, which is more than a dozen locations around this area, there is a need to take care of our patients in this area and our patients that are leaving the hospital, the emergency room, and even our urgent care patients that we're going to be working with in the same building. So with the loss of pharmacies around town, it's making the pharmacies busier and taking longer for patients to receive medications. So we have done a lot of work within our own pharmacies to help alleviate some of the stress for the patients.
And when someone steps inside here, what can they expect? Walk me through. I think you are the expert on the pharmacy. What can they expect when they walk through those doors?
Well, when they walk through the doors, they're going to be greeted in the general lobby area for all teams. And we are going to be towards the back of the building. And our pharmacy will offer a drive-through, which is much needed in this area, as well as just ability to get the prescriptions out in a timely manner. We're going to have a nice space back there and a front-end area of OTC items and some other small items for patients to purchase if they do need those. So it's going to be a retail pharmacy just on a smaller scale as what they saw when Rite Aid was in the building.
I've heard that other locations have been successful. If you want to talk about kind of other places that are doing the same thing.
So yeah, putting multiple departments within a building, it helps take care of your patients quicker. And other, pharmacies around town have also, experienced the gain in business as well, hours expansion, hiring. So there's a lot of back work that pharmacies are doing to help try to take care of the patients while, we undergo all these significant changes in the area.
Obviously, lots of Rite Aids leaving. There's a pharmacy desert, but why was it important for U of M Sparrow to be that organization that fills those gaps?
Well, they're our patients. A lot of them are our patients. And so being there for them and letting them know that they're supported by us is important because, we are far-reaching as an entire health system. So those deserts do make a big difference for patients in getting their medication.
Anything else you want to add that we didn't touch on?
Going forward, if UM Health-Sparrow finds this model and this location successful, would they consider doing this in other communities across their footprint?
Yes, I know that everything will be looked at very extensively to make sure that if we go in there, we can take care of the patients and meet their needs, but it will take some time.
Sure.
Can you just speak about kind of what your teams have been going through since the closure of Rite Aids and the amount of pressure that's been on them and how they've been able to help the community in their time of need?
Sure. Yeah, so with the increased volumes that have been expanded from the Rite Aids to all the neighboring pharmacies, yes, our team has stepped up tremendously. We've hired to help, try to take on that load for everybody and just meet the needs of the community.
Yeah, and like we were just talking about, talk about integrating all of these resources into one building.
Yeah, so we're so excited about not only the individual components of this building, but the synergy and how they will all work in harmony with one another.
I guess, is that something new? Is that like a new thing that I guess is being put into more buildings, or is that something we've seen for a while that's been working?
This is new. This concept is something that is new, and I think, again, by doing so, it'll increase access, it'll increase efficiency, and when we look at especially our hundreds of corporate clients that we have throughout the mid-Michigan area, it will allow us to better serve them.
And I mean, I think following up with that, talk about the clients, talk about why it's important to offer convenience.
Yeah, so I think our patients are looking for added convenience, and we're finding ways to increase access to care. And so by bringing these services together, it allows our patients to come to one location and receive everything that they need.
Talk to me about, obviously this is very convenient being right across the street from the hospital.
Yeah, so the location is perfect because not only is it in close proximity to the hospital, but even just being on the corner of Michigan Avenue in Pennsylvania just provides easy access, easy parking for our patients.
Can you talk about, especially for just an overview it again, can you talk about the services that your team is going to provide in the building and what's unique about their services together?
Yeah, so again, when you look at the services, it's the traditional services that we offer at our other occupational health facilities as well as our urgent cares, but it's bringing these together that is unique. And in doing so, it again allows our corporate clients to be able to come to this location and not only receive occupational health services, but be able to receive expanded acute injury care 7 days a week.
And having this will probably alleviate some of the lines at your other facilities.
Definitely. One of the things that we are looking to do is to expand our provider coverage at this location, which will decrease wait time and allow us to service more of our community.
And then are you able to touch on, because I don't know who touch on who, but kind of the I guess timeline or progression of the building?
We'll have Connie answer that one for you.
Okay.
Timeline?
Summer for pharmacy, hopefully across the state by then, and then fall for the
Anything else you want to share?
I think I'm good.
For the future?
Hopes for the future. I think this was covered a little bit earlier, but I'd like to see this model be duplicated and something that we could expand on and build from kind of moving forward.